want to make sure we don't have to repeat any information. Okay, we are live. Sorry about that. Go ahead, Jonathan.
No problem. Hello, everyone, and welcome to the November 30th Social Justice Task Force meeting. I will now call this meeting to order. With that said, Marcus Smith, will you do us the honors of walk us through the Pledge of Allegiance? Jasmine will display it on the screen, just so you know.
Absolutely. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice.
Thank you. Thank you for that. The next piece is for us to go through and do roll call. Jasmine, can you do us the honors?
Jonathan Wilson.
Here.
Marcus Smith.
Here.
Jorge Separac.
Here.
Krupa Desai.
Here.
Daniel Zamilpa.
Here.
Giselle Washington.
Here.
Shannon Morton.
Shannon, I think you may be on mute.
Here, present.
Sorry, and really quickly, hopefully I'm not mispronouncing your name. Kari, would you mind just turning your camera off until we get to your item? Sorry, thank you. We're all good, Jonathan.
All right, perfect. So now can I get an approval of the minutes for those of you who've gone through it? So
Motion to approve the minutes, Zamilpa.
can we get a second?
Second.
You've been noted. Jasmine, do you want to take a vote?
Sure thing. Jonathan Wilson.
Aye.
Marcus Smith.
Aye.
Jorge Separac.
Aye.
Krupa Desai.
Aye.
Daniel Zamilpa.
Aye.
Giselle Washington.
Aye.
Shannon Morton.
Aye.
Motion passes.
Great. Excellent. For public comment, now we're on item 5 of the agenda, just so you guys know. This time is set aside for public comment. So the public is given the opportunity to address the Social Justice Task Force on any item within its responsibility. Pursuant to the Brown Act, the Social Justice Task Force cannot take action on items not listed in the posted agenda. Each speaker will be allotted 2 minutes, and time may be limited or increased based on the discretion of the task force. This public comment period is to address the Social Justice Task Force on agenda items and/or items of general interest within the jurisdiction of the Social Justice Task Force. If there's anyone who didn't sign up to speak and wish to provide comment, please use the raise your hand feature in the Zoom. So my understanding is that there's no one that signed up via Jasmine. So if anybody does want to speak, please raise your hand. I'm going to do one more call for anybody in the public that wants to speak. Please raise your hand. All right, so we're going to move on to item number 6 then, in that case. Item number 6, the task force will receive an update from the city's social services division on the social service utilization and needs assessment, focusing on community members of color in West Hollywood. So with that said, I would love to welcome our speaker from the city's social services division.
Hi there.
Hello, Katie.
Hello, and good evening, Social Justice Task Force members. My name is Katie Egan, and I am a Social Services Program Administrator for the City of West Hollywood. I'm joined tonight by my colleagues in the Social Services Division, Francisco Gomez and Doug Wynn, as well as our manager, David Juni. And we are also joined by our contracted consultant team from Maroon Society. Tonight, we're going to be presenting information regarding the city's needs assessment focused on community members of color. For a little bit of background to start, in October 2020, City Council directed staff to analyze the social services needs of people of color in West Hollywood. As a result of that directive, staff studied service utilization by people of color during the 2020 contract year and presented findings to City Council in spring 2021. In addition to that report, staff brought a 10-year retrospective analysis of service utilization by non-white community members to Council and to the Social Justice Task Force a few months back in August. While both staff reports provided insight into social service utilization by people of color, quantitative data alone cannot clearly address the directives that were given to the Social Services Division from City Council. As you might recall, in our August presentation, we mentioned that additional research and analysis were needed in order to understand the complexities between and among the different non-white communities in the city. People of color are not a monolith, and it's important that the city hear directly from different groups with unique cultural and ethnic backgrounds to understand any potential gaps in services. The need for this direct feedback is especially felt among Black, Indigenous, and other people of color who face centuries of systemic inequality in American economic, housing, education, and healthcare systems. The City of West Hollywood periodically conducts community studies to guide social services funding priorities. The most recent study was completed in 2019. Past studies have focused on different target populations, including gay men, seniors, families with children, households affected by HIV/AIDS, women, people with disabilities, and immigrants from countries of the former Soviet Union. The unique needs of community members of color, however, have not been analyzed in previous studies. For these reasons, during the August meeting, staff introduced the city's plan to conduct a needs assessment focused on people of color. The city released an RFQ for the needs assessment in mid-August, and on November 3rd, City Council approved an agreement for services with Maroon Society. Maroon Society is a local research firm with a strong history of providing needs assessment and program evaluation services to local government agencies. Since 2016, Maroon Society has worked with the City of West Hollywood to develop the HIV Zero Initiative strategic plan and conduct the multi-year evaluation of the initiative's progress. Outside of their work with West Hollywood, many of Maroon Society's projects focus on community members of color with intersectional marginalized identities. Staff from Maroon Society are here today to discuss the scope of work and the timeline for the needs assessment. So now I'm pleased to stop talking and to introduce you to Aaron Celius. He's the Director of Research and Strategy at Maroon Society, and he will introduce the rest of his team and begin their presentation about the project. Pass it over to Aaron.
Thank you, Katie. Pleased to be here for Maroon Society on behalf of the Maroon Society team. The team includes Dr. Kahari Brown, Patricia Ortega, Brandon Harrison, and myself, Dr. Aaron Celius. And I know that you have a pretty full agenda, so we will do our best to keep the presentation tight so that you can move forward with the next items, as well as give you an opportunity to ask us any questions that we may be able to further expand upon. So with that, let's see, start sharing the screen.
I just gave you the capabilities, so
Thank
see
you.
if it, yeah.
Thank you. Okay. So good evening, everyone. Again, we're going to talk about the needs assessment, our approach to conducting this needs assessment for the city of West Hollywood. So just to give a bit of background, I believe Katie gave a great background, but just help contextualize it more. So over the past few years, as you all know, public awareness about the persistent racial disparities in most of the core quality of life indicators has been growing. These quality of life indicators, as we see them, are income, employment, life expectancy, education, housing, and safety. And the city of West Hollywood is no different in recognizing the disparities historically as well as nationwide that persist. And for this reason, they definitely wanted to understand the extent to which these disparities may exist in the city of West Hollywood when it comes to community members of color accessing social services. And so the two primary things that we're going to looking at include how community members of color utilize social services and what new services may be offered to better meet their needs. So the primary questions we have include, what are the eligibility variations that exist among community members of color? For example, every community of color, every person in the city of West Hollywood doesn't have an equal level of need. And so we're going to look at what type of eligibility variation exists among community members of color for various social services based on the current social services profile in the city. Second, we're going to look at service utilization. As Katie had mentioned, they've already done a 10-year retrospective of social services utilization. We intend to supplement that retrospective analysis by looking at it with the frame of what are the actual needs of community members of color. And we're going to contextualize that using census data, and Dr. Brown will talk about that a little bit further. The third thing we're looking at are the barriers and facilitators of access and use. That's exactly what it sounds like. What are the barriers that community members of color face when attempting to access social services in the city of West Hollywood? And what type of factors are making it easier for community members of color to utilize the services that currently exist? And then finally, we're also going to explore what are the new services that community members of color would like to receive from the city. And overall, the primary question is, how can West Hollywood increase access to social services for community members of color? And now we're going to talk a little bit about the approach, and I will turn it over to Dr. Brown.
Okay, thank you. Hello, everyone. In this needs assessment, one of our initial tasks is to examine the eligibility standards for each West Hollywood service provider. And to do this, we'll use the census and regional surveys, as Dr. Celia stated. We'll use the census and regional surveys like the Los Angeles Homeless Services Authority and the West Hollywood Community Survey to estimate the proportion of each race group that is eligible for the services that West Hollywood service providers provide based upon their age, disability, income status, house status, etc. For example, according to the report on social services utilization by community members of color, whites are 25% of West Hollywood's homelessness population, but are 40% of those individuals that utilize homelessness services. So this indicates that whites are overrepresented among those that access homelessness services. In contrast, non-whites are roughly 3/4 of the homeless population, but 60% of those receiving services, suggesting that they are underrepresented. So the extent to which we observe these types of race disparities in a service utilization among a given service provider, we'll interview staff and conduct surveys to identify potential barriers in access for racial minority groups. Now, we're also looking for best practices among service providers. So the extent to which we observe adequate or overrepresentation in service utilization among racial and ethnic minorities, we'll employ the same methodological approach to understand what they are doing to adequately meet the needs of racial minorities. And with that, I'll turn it over to my team members to discuss our methodological approach in more depth.
Thank you. I believe now we're turning it over to Patricia Ortega to talk about the barriers and facilitators. Oh, 1 second.
Yeah, I think you're on mute.
You're muted right now.
So what we're going to do is we're going to actually, I don't think I did the barriers and facilitators. I did focus groups and eligibility survey.
Sorry about that.
It's okay.
So I'll speak about the social services provider interviews. So one thing that we want to do is understand the context within which the social services are being offered. And to do that, we believe that there's value in conducting interviews with social services providers. Interviews with those that have really high utilization rates, as well as those that have lower utilization rates, to understand among those that have higher utilization rates, what are they doing that maybe others are not doing, that other service providers, social services providers could learn from. As well as on the other end, we want to look at some of the social services providers that have low utilization by community members of color. And we would like to understand what are some of the barriers that they may be facing to understand how they could overcome them. We know that just anecdotally, if sometimes when people don't see themselves reflected in the places that they go for services, they don't feel as comfortable, and that could be one of the barriers to use. And so we want to explore that through these interviews among social services providers. We also, as part of that, we intend to conduct a small survey among the current social services providers to measure the same sort of questions, but more in a quantitative way, about their sense of best practices for providing social services to community members of color, as well as looking at the demographic profile of the frontline staff that are both developing the services and being the face of the particular programs, to determine if there is any relationship between high social services utilization and the demographic, race, ethnicity of the people providing services, as well as on the other end, if there's any relationship with race and lower utilization among community members of color. And now I will turn it over to Patricia to speak about the focus groups.
Thank you. So going back to what Dr. Celias had mentioned, one of the main issues that we're trying to address, it is what are the barriers and facilitators to use to accessing social services in the city. So we could talk to people that are already using our services and we can get information from them. But what we really want to know is why people of color who are aware of the services are not using them. So to explore why people who are aware of the services and eligible for the services are not using them, we're going to conduct focus groups in both Spanish and English. So pensamos que es importante hacer los grupos de enfoque en español porque creemos que hay mucha gente que solo habla español en la ciudad de West Hollywood. So for people who didn't understand what I said, I was speaking in Spanish. And what I said was that we believe that focus groups in Spanish are important because there's a large number of people in West Hollywood that may only speak Spanish. So in terms of the content of the focus groups, we are going to look at the perceptions of the community in terms of social services. So that is of the current services, potential new services, and also we are going to look at the barriers and facilitators to use of those services. Then Dr. Celias also talked about a survey. So it's called the eligibility survey. So going back, this we are going to analyze data in both a quantitative manner and a qualitative manner. And so the qualitative manner, I just talked about it. So we're going to do focus groups, and the focus groups are going to target our understanding of the community's wants, needs, and barriers. So we're also going to have a quantitative analysis, and that quantitative analysis would be with the survey. So with the survey, the goal is to understand and measure the extent in which the community members are eligible and interested in the services that West Hollywood is providing. So what typically makes somebody eligible is if they live, own property, attend school, or if they have spent a significant amount of time homeless in the city of West Hollywood. So we're focusing on two groups in specific. So that is people who work in the city of West Hollywood but do not live. And then we're also focusing on people who are community members but may not be working. So that would include seniors and people with disabilities who may qualify for the services but are not aware that they qualify. And then what we're going to do in terms of the survey and how we're going to approach people is going to be in-person outreach. So that would be doing in-person surveys. We're going to also have a survey available in the city of West Hollywood's website so people can take it there. And in addition, we are going to have QR codes in high visibility areas around West Hollywood so people can take the survey in the street as well and use their phone. So that is going to be how we're going to approach the eligibility survey.
Thank you, Patricia. I will speak a bit about the schedule. What you see in front of you is the tight timeline for this project. It's on such an accelerated timeline because the results from the study will inform the next wave of procurement for the city of West Hollywood. So the next request for proposal cycle. And right now we are currently doing the demographic profile, qualification criteria, and utilization that Dr. Brown mentioned. Next, we will be getting into the social service provider interviews and surveys that I spoke about. I'll apologize to my colleague Brandon. That was an area that he was going to speak about, but it was unclear if he would be able to get on because there were some technical issues. So I apologize for that, but that's the area that Brandon and I are focusing on, as well as the next section, barriers and facilitators. You see that's happening within the next 2 months, December and January, and then we will be moving toward the quantitative phase, the eligibility survey in January and February. Our intention is to come back to this body, to your group, in February, March, to give you an update on our progress and preliminary results. And with that, I will open it up to discussion.
Are there any speakers for this item? If so, and you're interested in speaking and providing comment, please use your raise your hand feature in Zoom. Okay. Are there any task force members that would like to make comment?
Hi, Dana Zmopa. Pronouns are he, they. I know that at the beginning of the discussion that had been mentioned that there had been several other exploratory exercises done like this for other communities, gay men, elderly people, etc. There wasn't any discussion at that point as far as intersectionality or anything like that. Is that going to be included as part of this as well? Or will this strictly be just looking at people of color?
So this needs assessment is in response to the council directive that I had mentioned in the introduction. And so that council directive specifically wanted to look at folks of color with an emphasis on some of those quality of life issues that Dr. Celias highlighted. So that's going to be the focus of this project. But that's not to say that we can't take a closer look at some of those intersectionalities in future studies.
Okay, perfect. Yeah, I mean, again, just West Hollywood being as diverse as it is, I know that, for people of color versus their queer people of color experience is very different. So I just want to make sure that intersectionality is taken into account. Thank you.
So I have one question around, you had mentioned that you were this is going to inform the RFP process or the outputs were. The other side of that though is, what change are we making to the RFP process in absence of these results? So are there other changes that we're looking to make? Help me understand. I understand that fits into a larger picture, but what is the big picture, I guess, around the RFP process that we're looking to impact?
Yeah, so as I mentioned previously, so those community studies that we've done in the past, we have used that direct feedback that we've gotten from community members at large, but also from those target groups that we were looking at. And we've used that feedback in order to inform the types of services that we are looking for in that RFP. So I believe in the last grant cycle that we had an emphasis particularly on a need for increased services for our transgender community members. So the idea behind this needs assessment is that we would use the feedback from the focus groups and the surveys around the type of services that might be missing or the type of services that are desired. And then we would incorporate that into the RFP itself so that we can identify social services organizations that we can partner with who would be able to provide those services. Does that answer your question?
I guess my question was more around how we're selecting, right? So it's one thing to change what we're looking for through questions, but it's another way, and it's another aspect to think about how we're evaluating these potential service providers. And that's where I was kind of wondering if we're looking at that at all.
Yeah, and I know my manager, David Juni's on the call. I don't know if he wants to speak to how we've evaluated those applicants in previous grant cycles.
Good evening, and thank you for inviting us to present to you this evening. I'm David Juni, the City's Social Services Manager. And Jasmine did mention that we might also want to talk a little bit more in depth about the RFP and the social services funding process. As Katie mentioned, we are working on the actual RFP document as we speak. The city is on a 3-year contract cycle for social services. We just entered into the 3rd year of the current cycle. So the current cycle is 2019 through 2022. Social services contract year starts in October, runs through September. So just entered this 3rd year, and we will begin the RFP process. So just a little bit to touch base on what Katie was saying, the services that we focus on and highlight in the document are driven by initiatives from council, and then also from input from the boards and commissions and from the Social Justice Task Force. The previous RFP highlighted the Aging in Place Initiative, the HIV Zero Initiative, the Poverty Initiative, and the 5-year plan to address homelessness. And then overarching, it was informed and information was provided to the potential applicants through the 2019 community study, which also Dr. Salias and his team mentioned. This year, a major focus and highlight will be the results of this needs assessment of community members of color's access to service. It is a very in-depth funding process. We begin basically next month in January. The process is driven by the Human Services Commission. Staff visits each of the boards and the Public Safety and the Rent Stabilization Commission to receive feedback on services needed by their constituency, what's been accessed, what are the barriers, some of the similar things that Aaron and his team, Dr. Silius and his team will be looking at specifically for community members of color. We will come to the Social Justice Task Force to receive your input. So we do those visits in January and February. We bring the chairs of each of the boards and the commissions to the commission to provide direct input to the commission on what should be highlighted for the next RFP process. We then we have a public hearing that starts in April that all of the community is welcomed and encouraged to attend, including service providers, to also provide input on services needed, what's missing, what are the barriers, what's being accessed. From there, we release first the RFP document is taken to the commission and to council for approval, and we release it in May. The term for turning an application is usually the middle of June. We have a process. Each of the human services commissioners read the proposals. They have a rating scale that they base their recommendations on. Each of council is provided the applications as well. We usually get an average of about 50 to 55 applications. We are looking at the full continuum of social services. So for services for children and families, all the way to services for seniors, substance abuse, mental health. This year, also, in addition to the initiatives that I mentioned and the results from this needs assessment, council has talked about they really would like us to focus on providing more pretrial services and also services that address alternatives to incarceration. So we just, at the last council meeting, reported what's in place and how we are working with the LA County Public Defender's Office on bringing more of those services to West Hollywood. The process, and I have, if we want to share our screen, I put the whole schedule of the funding process and the involvement by the commission and the council. But after, as I mentioned, the applications are turned in June, commission and council review them, staff makes recommendations at another public hearing. So once we make those recommendations, we want to get feedback and input from the community on those recommendations. We work with the Human Services Commission to attempt to bring a unified set of recommendations for contracts to council. They go to council in September, and then we execute, once approved, we execute those in the following October. So that's a little bit of an overview of the process.
And if I could just jump in, I think part of your question clicked in my brain while David was talking to. The Maroon Society team also mentioned that survey that they want to do with our current contracted agencies around demographic makeup of frontline staff and other interviews that they want to do with our service providers who maybe have higher utilization by community members of color versus those that do not. So we'll definitely want to take a look at that and see, what's working and what's not, and incorporate that into our thinking as we look at the RFP as well.
You nailed the direction I was actually headed in, Katie. That was
yes, and I'm sorry it took my brain a second to process it.
But yeah, no, it's good. So that was exactly what that's where I headed. So thank you. I don't want to steal all time. Marcus, I believe you have a question.
Hi, Katie. Just what's the current marketing process now for the services that are offered? I've seen, the postcards in the mail, but what if you don't have a physical address? Specifically the homeless. Are there billboards? Are there bus signage, street signage? What's that current process look like now?
Yeah, so I actually work with our homeless services agencies, so I'll speak to them first and then talk about the rest of the services as well. So the Homeless Initiative does have billboards. You might have seen them at the bus stops, where there is advertised our homeless concern line. That number goes directly to social services staff who answer those calls and connect people directly to services. In the last grant year, we also provided all of our contracted agency partners with additional funds to go towards outreach and communications. So each of the agencies that we partner with do their own promotion in addition to that. And then we also recently, all of the information about social services are available on the city's website. And we did recently release a comprehensive guide of social services in 3 languages, English, Spanish, and Russian. And I believe that those were distributed via mail to all of our residents. But again, for the folks who are experiencing homelessness, we have those billboards, we have the homeless concern line, and then we also have outreach teams who are out on the street essentially every day in the city of West Hollywood, And so those folks go out and engage with our community members who are experiencing homelessness and inform them about services as well. They also offer direct services in the form of food, water bottles, things of that nature. And so they also pass out business cards too, so folks can easily access them if they have access to a cell phone.
Great.
Thank you.
Good. Jorge, do you have a question? By the way, Marcus, that was sufficient. I just want to validate. Yeah, he said thank you. So, okay. Jorge, you had a question?
Well, it's not a question. For me, I think that we need to focus, or social service need to focus on the person that they are in the front, that the person that they have the deal with the person that need help, because sometimes that happen that it's a lack of communication, or it's not people that it doesn't make a big effort to help other people. That happen everywhere, every aspect. Like yesterday, I have an issue with a ticket, for my vacations. It depends who answers the phone. Some people really help you to do it. Some other people don't do anything. So I think that it would be good to train the person that is going to be in charge of this, to try to make things more not complicated for the person that need the help. Because sometimes, people just, because they have that bad experience, they say, oh no, I need the help, but they're making these things too complicated. Like even today, I went to have my vaccine, my third doses. Actually, I went yesterday. They told me, oh no, your appointment for tomorrow. And my mind was like, by saying here, if for what I know, and the other place I went, it was like 100 people that they were just doing the shot. I said, okay, I come in tomorrow. So I came today again. Finally, when I was started out the office, they told me, oh, but we don't have Pfizer, we have Moderna. I said, but why you guys never told me? So it's things like that, that make people don't go to ask for things. When the person that is in front doesn't know how to communicate or gives a good service, people decide to don't ask anymore. So I think that we need to train better, who is going to be in front to taking care of these cases.
So what you're asking for is consistency and simplicity.
Yes, because sometimes it's complicated. People don't know, they go, they don't have a good service, or they just go away,
That's helpful feedback. Thank you.
Great. Thank you, Jorge. Aaron, you have your hand up. I think
yeah, I don't know
you're part of the speaking committee.
I know, it's weird. So I just wanted to follow up on a few things that I heard. One, in terms of intersectionality, what Maroon Society does, the studies that we do, it always addresses the intersectional identities of community members. Beyond that, and I should say in addition to that, the services, the social services, the current profile of the social services in the city of West Hollywood are really all about intersectionality. And so it's including gender, sexual identity. Almost half of them are addressing sexual identity and HIV risk, both treatment and prevention services. HIV status is another one that's very large in the city of West Hollywood. Disability status, poverty or income status, and as well as age. And so what we both appreciate the intersectional identities of community members of color, as well as the intersectional identities of the West Hollywood community. That's what really makes it so rich. And so it would be impossible for this study not to be intersectional in nature, just given the fact that the social services that we're looking at are intersectional already. One, and two, that's our approach to every study that we do. So that's one thing. And then I wanted to address the question I believe Marcus had about marketing. So that question is really going to be addressed in our qualitative phase of the study, where we're asking people, how are you currently getting the word out about your services? We too have this hypothesis that if there's lower utilization by community members of color who are qualified, that it's likely an awareness issue. And so oftentimes when you know, we know if the people that have the resources, if you don't look like them, it's unlikely that you're going to get that information as easily. And so that's a question that we want to explore in this study. We don't know what we will find, but that's why we're doing both the interviews with providers as well as that follow-up survey, so that we can have a comprehensive look at all of the social service providers to determine what's happening. So if there is a way that certain providers are getting the word out that's more effective than others, we're going to be able to identify that in the study that we're doing, as well as if there are gaps that perhaps we can inform current providers on how they could be more effective in their the process of raising awareness. We also will be able to identify that. So I just wanted to address those two things.
Just to ask a follow-up question, does that mean that is going to be in the form of like a playbook, a checklist, something like that? Is that what you're thinking about?
When you say playbook or checklist, can you help me understand better what you mean by that?
So if you're saying these are the 5 things that you need to make sure you're doing when you're marketing, or these are the 5 things that you need to do when you're servicing.
I see what you're saying. So yeah, like a best practices. We believe as a result of what both the conversations, the qualitative and open conversations we have, as well as the quantitative, we'll be able to identify what some providers are doing that is more effective. And it could be a situation where there is a best practices where it's like, you know, have someone that looks like the audience that you're trying to reach, have cultural competency in the communication and the messaging that you're putting out, put it in a place that that audience is going to likely be able to consume. I mean, so those are things that we have looked at for many years, and we anticipate looking at and identifying in this study as well.
Great. Any additional questions? All right. Well, thank you guys for your time. This was definitely a great presentation, and look forward to seeing some more of the results of your focus groups and as we move towards the RFP process.
Thank you all.
Thank you. Have a good night.
Thank you.
Thank you. Take care.
At this time, we want to move on to agenda number 7, where we'll hear from Captain Ed Ramirez and Lieutenant Bill Mulder from the West Hollywood Sheriff's Station. I'm not sure if the plan was actually have Shay Gibson also speak at the same time, or just have the two of them. Okay, then we'll also introduce Shay Gibson. She's an operations manager from the Block by Block.
Sure. So I let Captain Ramirez, Lieutenant Mulder, and Shay know that I would just read off the questions. And then if task force members wanted to follow up on that, they could. I just figured that might be easiest.
Great.
I just wanted to take a second. We also have our public safety director for the city, Kristen Cook, here as well.
Oh, great. Thanks, Christine, for joining.
Nice to see you all.
Okay. So the first question is for Captain Ramirez and Lieutenant Mulder. What are your observations and perspectives around public safety priorities for the city of West Hollywood? In addition, what is the vision for the department and its role in the city?
Okay, first off, hi, everybody. Thank you. This is Ed Ramirez. Thanks for having me tonight. Pleasure to be with you. I apologize for not having my camera on. I'm having some technical difficulties here. It goes in and out periodically, so I'm looking at getting a new camera. So, what I'd first like to start out with is, the city of West Hollywood has a long history of promoting justice and equity by utilizing creative solutions and funding robust social services, to support our residents. While the number of patrol deputies has remained stable and even slightly decreased over the last 20 years, there have been significant increases in civilian security teams, and I mean, by the means of Block by Block and PAC West, code compliance, staffing, and contracted social service agencies. Residents and businesses have expressed concerns with traffic, parking, homelessness, and quality of life issues. very similar to what was reported in the public safety outreach survey in 2016. So the city built a combination of law enforcement, civilian public safety, code compliance, and social services to address these overlapping issues and concerns. Staff from multiple departments within the city have been working with the Public Safety Commission to provide input on current and possible programs and policies to promote justice and equity in policing. Additionally, I'd like to add that, I've been here at the city of West Hollywood for probably close to 7 years now. And when I first became the service area lieutenant 5 years ago, I worked very closely with Public Safety Director Kristen Cook to put our collective heads together to figure out how we tackle this this crime issue that we're having in the city of West Hollywood. And Kristen and I, we decided, I think it's important to increase our foot beats, both on the east side and the west side. And we did just that with additional monies funded by the city of West Hollywood. And then I was an active participant in that as a lieutenant, having physically walked over 100 foot beats. I can tell you that they are effective, and I'm as a huge believer in the community policing process are a staple, the very staple of community-based policing. One of the things I'd like to implement full-time are foot beat and a bike patrol team. And I'm really excited with this implementation of the city's behavioral health crisis unit, because what this will do will free up my deputies to do more proactive policing to reduce the problems that currently affect us the most. And these problems are mail theft, street robberies, assaults, and vehicle burglaries. And also I'd like to add that over the past 5 years, we have successfully decreased the crime rate in the city 20%. And there are not very many cities in the city of Los Angeles or in the county of Los Angeles that can say that. My priority is to continue decreasing the crime rate, or at minimum, keep it stable. Did I answer the question, Jasmine, or was there another one?
I believe so. Oh, we have a list of them. So that was just the first one.
All right.
So I'll alternate too. So this next one is for Shay. What is the criteria for security ambassadors that are hired, and how are they trained?
Okay, well, good evening, everyone. I hope everyone's doing fine and staying safe. So to answer your question, the criteria for a security ambassador that is hired, they must have a security guard certification. They must pass a criminal background check. They must pass a drug test. Of course, now they must be vaccinated as well. They also have to be a person who likes outdoors and must like working with people, because we do add a very heavy hospitality element to what we do. How they're trained is we do conduct bi-weekly trainings on various topics, such as de-escalation, emergency action plans, engagement with people on the street. And then we also take those topics to the field for training to support those bi-weekly categories.
Awesome, thank you. Back to Captain Ramirez. Can you speak to the awareness or stance around white extremist affiliations within the Sheriff's Department?
Let me take myself off mute there. Sorry about that. Yeah, like you guys, I have also read in various reports and in newspapers in regards to what you are discussing in regards to white extremist affiliations. But what I can tell you as the chief of police here in the city of West Hollywood is that the city of West Hollywood has never had this issue. It does not currently have this issue. And as long as I'm in charge, we'll never have this issue. Additionally, I'm not aware of any West Hollywood station member who is affiliated with any extremist group. The department has a strict policy that prohibits personnel who join any groups which promote conduct that violates the rights of other employees or member of the public. My personal feeling on this is these groups undermine the department's goals, and they quite frankly, create a negative public perception of the department, which increases the risk of civil liability to the department and any involved personnel. I'd also like to add that any employee engaging in misconduct of any kind is subject to discipline, and that ranges from written reprimands to being fired from the sheriff's department.
Thank you, Captain. Again, for the task force members, if you wanted to elaborate or follow up on any of these questions, just feel free to unmute yourself. So next question is for Shay. What are your biggest challenges in protecting the city of West Hollywood? What are things that you may need to better serve the community?
So I would say that our biggest challenges would be our capabilities. And what I mean by that is, we're not a company who, we do not arrest, we do not detain, we do not chase down criminals. We're here to be an extra set of eyes and ears for the police, serve as a visible deterrent, and give the best description that we can if some foul activity is happening. So I think that, a lot of people or some of the residents really would like us to have the same capabilities as the sheriffs, and we do not. We always suggest that they get the sheriffs involved, especially if it's in a violent situation. And as far as being able to serve the community better, I think just an overall education of our services, so that the community knows exactly what to utilize our services for versus the sheriff's. Sometimes people seem to try to circumvent the sheriff's station for whatever matter, and they'll call us, depending on the situation, we'll show up, but we assess the situation, and this may be a situation that's the sheriffs are needed. And then the resident may get upset at us because we can't perform that particular duty. But I think that just a re-education of exactly what we can do and why they should be calling us would help us greatly as far as better serving the community.
Thank you. Appreciate that. Captain Ramirez, this one is for you. What is the vaccination status of personnel within the department at the West Hollywood station? And what is the approach to enforcement of city, state, or federal mandates within the department and around West Hollywood?
Okay, in regards to the first question, the department and West Hollywood Station are following the mandate from the Los Angeles County Board of Supervisors. And like other agencies throughout the country, there are some that aren't fully vaccinated and are some that are not vaccinated at all. That said, currently, the city of West Hollywood, we have about 100 people vaccinated and 44 employees who are currently not fully vaccinated. I believe it's as we move forward here and as the county implements other measures, that we will be close to 100% here in the city of West Hollywood. That said, as far as the approach to enforcement in the city, West Hollywood was a city, one of the first cities to implement or give out citations for those not wearing masks. We gave out over 100 citations, and currently we are not necessarily enforcing the mask, the mandate in our businesses. However, when our businesses, we don't walk around and look for people violating it. But however, we will take the phone calls from businesses, and if there is an issue, we will send deputy sheriffs in to talk to the folks. But it hasn't been much of an issue here in the city of West Hollywood. Folks that visit here and folks who live here are pretty law-abiding and go along with the program. And it usually takes just a deputy sheriff to go over there and talk to them in a kind and polite manner. And these folks are more than willing either to put on a mask or to go outside into the patio area, whatever fits best.
Can I ask a quick follow-up? Thank you, Captain Ramirez. I think I'm curious to hear just what your perspective is on the way in which vaccinations and mask mandates align with public safety.
Well, first and foremost, I mean, if you listen to the science, I believe everybody should be vaccinated. Everybody should be vaccinated. And I think it's proven that wearing a mask actually helps the spread of the virus. I wish everybody in our community, and that includes our law enforcement officers, abided by the implementation of the rules and the safety protocols. Unfortunately, there are some, and my best guess is for reasons related to politics, they're just refusing to do so. But that's the bridge we are currently at, and we're trying to work with everybody to get through this and get back to some sense of normalcy, as you guys are probably hoping for as well.
Follow-up question as well. Just to maybe think through, I'd love to hear kind of where we were in comparison, because 44 out of 144 people not being vaccinated seems like a lot to me, but it may not be, compared to where you were maybe, let's say, a few months ago. So maybe, can you help us like put it in context? Like how many people have gotten back? How have the numbers moved over the course of the past few months, maybe?
Well, for this particular, I really pulled the numbers. I don't have an answer as how many were vaccinated a few months ago. These are our current numbers, and they could have changed as of today. I don't know, but I am certain that if you ask me, as we move forward, if you ask me in January or February, I surmise we're going to be close to 100%.
Okay. The only reason I ask this is because, like, I mean, what City of West Hollywood is somewhere around 80%. So to have a law enforcement that's not around 80% just seems question mark to me. But that's the only reason I said that.
I would like us to be at 100%.
Aligned.
Thank you, Captain Ramirez.
I want to point, but last thing, I'm just a statement. I think it's like, if we want to be at 100%, how do we lean and prioritize our actions accordingly, rather than waiting for like more mandates or more requirements? Like Shay just said over here, like they're vaccinated. Like that's a choice they're making, and that's how they are safely engaging with our community. So I appreciate that we're aligned on the goal, but I think if we want to get there, we actually have to take action to get there.
Yeah, and there are ways that we are working with the county. As you well know, there are unions involved. There are a number of other factors. Again, at the end of the day, I fully expect us to be at 100%. I wish this train was moving a lot faster. Unfortunately, at this point, dealing with bureaucracy, dealing with county government, dealing with unions, dealing with the politics of things, the sheriff department and members of the department are no different than members of our communities and members who have their views and visions or beliefs on the vaccines in general. And as long as we're drawing from the human element, we are going to have those issues as well.
Thanks, Captain Ramirez. Next question is for Shay. And I'm sure this answer probably depends on the particular situation, but in the face of conflict with a citizen, what is the path for de-escalation?
Well, our path for de-escalation would definitely be to calmly approach the situation And in my experience, just allowing the individual to speak their piece. From that point, try to assess what the best way would be to assist in rectifying the situation there. Most of the time, from my experience, if you're approaching a situation calmly and allowing the person to get off their chest whatever it is that they're trying to express, and most people just want to be heard. We may not be able to do exactly what they want us to do at that moment, but we can definitely make a great attempt at trying to offset whatever it is that they're going through.
This question arose from a recent report that came out, or an incident that came out regarding somebody who was mouthing off, and at some point they were supposedly or allegedly attacked by a few different block by block officers. And so maybe I'm misinterpreting, but this came about just because I'm trying to make sure that's not the case.
Yeah, I definitely do hope that's a misinterpretation, because I that escapes me. I haven't heard anything of that nature, and we definitely don't conduct business that way.
Fantastic. Thank you.
Thank you, Shay. Let's see, Captain Ramirez, I think you already touched on this, but this question is, what is the extent to which the department is already collaborating with social service departments? And it's a bit twofold, what policies are currently in place to help individuals experiencing homelessness?
Yeah, okay. The city of West Hollywood, the West Hollywood Sheriff Station has an excellent relationship with our city social service partners. Corey Plank, along with Public Safety Director Kristen Cook, coordinate and work together with the station, and specifically our cops team and entertainment policing teams, to provide delivery of services to people in our community. When deputies contact members of our community who are experiencing homelessness, mental health issues, or substance abuse disorder, there's information we provide them regarding the resources sponsored by the city. We can also connect them to social service providers directly, either personnel at one of the city contracted organizations or with city social services personnel directly. That said, the Social Services Division continues to work closely with various homeless, substance abuse treatment, mental health, LGBT, and HIV/AIDS service organizations to provide support and resources for the city of unhoused community members. And then despite significant challenges, teams from Ascensia, Step Up on Second, and the LA LGBT Center have continued to conduct street outreach to homeless community members throughout the pandemic, utilizing PPE and social distancing protocols. Case management and related programming have also continued over the phone, email, and on virtual platforms like Zoom whenever possible. As access to vaccinations has increased, so too have in-person case management and other needs services. Regards to Tarzana Treatment Center, we have an MOU with Tarzana Treatment Center to provide opportunities for individuals charged with issues related to substance abuse to access treatment recovery programs at Tarzana Treatment Center. Prior to the pandemic, Tarzana Treatment Center regularly conducted outreach with the homeless services organizations and participated in the Homeless Initiative outreach program at the library. Outreach staff have resumed independent street outreach and distributed city-provided hand sanitizers and disposable face masks to community members while engaging to talk about substance abuse and treatment. Agency staff continues to work with social service providers to ensure that West Hollywood community members have other social access to treatment services. The MOU with the sheriff provides an opportunity for Tarzana outreach staff to have an ongoing presence in West Hollywood while maintaining COVID-19 safety protocols. And with the sheriff department, the partnership with Tarzana Treatment Center really is, if we talk to somebody in our community who's got an issue or was arrested for drug-related problems or alcohol-related, or some type of drunken public problem not related to operating a motor vehicle, we will literally tell the person, hey, if you want to go into treatment, we right now will be willing to drop the charges. If you want to talk to a caseworker and sign up to go to Tarzana Treatment Center, we will not file charges. We will not press charges. There have been a few people who have taken us up on that offer. We wish there were more. However, we cannot force people into treatment. But it is a great program, and it has had some effect, positive effect.
Thank you, Captain. Okay, Shay, how is block by block structured?
So just to keep it simple, I'll focus on this one account. Since we're speaking of West Hollywood, we do have 127 accounts across the United States. But how it's structured is we have a regional vice president. I have a director of operations. Then you have myself, the manager, 2 supervisors, which I have 1 in the day and overnight supervisor, 5 team leads, and then the rest are the soldiers, are the ambassadors on the field.
Short and simple, I like that. Okay. Oh, go ahead, Marcus.
Shay, how many, I may have missed this, how many ambassadors total? And then for each total, and then how many are out on the streets for each day part? And also where are people staffed the most?
Okay, so we have about a total of 37 ambassadors right now, looking to stretch that to 40 by the end of the week. Most of the ambassadors are stationed, or you would see most of them on Santa Monica Boulevard. That's our main stretch of area going throughout the district, even though we do patrol the entire district. That's where you'll see us mainly. And then I'm sorry, I missed one of your questions. Can you repeat one of your, I think it was the second one. I'm sorry.
No, I think you, how many people per day?
Oh, per shift, right. Yeah. So we try to have a little bit more people at nighttime, starting from Wednesday through Sunday, being that the clubs are definitely a focal point for us. But you'll have anywhere between 7 to 8 ambassadors per shift. I think the morning shifts, well, let me rephrase that, 5 to 8 ambassadors per shift, because the morning shift we usually have a set of 5, and then we start to collect more as the other shifts come in.
Thank you.
Thank you, Shay. So this next question for Captain Ramirez, what are the sustainable DEI, diversity, equity, and inclusion initiatives for the Sheriff's Department?
Okay, first and foremost, the Sheriff's Department has had had a very strict policy of quality for many, many years. And this policy does a very good job at protecting our employees. The policy is intended to preserve the dignity, respect, and professionalism of the workplace, as well as protect the rights of employees to be free from things like discrimination, harassment, retaliation, and inappropriate conduct towards others based on state and federal mandates. As this type of behavior runs contrary to the values of the Sheriff's Department and to the values of the law enforcement profession as a whole. Additionally, the Sheriff's Department has committed to hiring personnel from the Los Angeles County community with the goal of further diversifying the department, so the department will continue to be representative of the community that we serve. In fact, the numbers I pulled up just for today, just to give you a snapshot of what our department looks like. It is currently 31% white, 7.5% Black, 5.5% Asian, 52.5% Hispanic, and 3.3% other. Additionally, the Sheriff's Department has academy training and continual in-service training regarding cultural diversity as it pertains to the communities we serve. All personnel are required to update their training throughout the year. Peace officers, it is important that peace officers need to recognize and respect the complexities of cultural diversity and continue to develop their skills, the skills necessary for identifying and responding to our state's changing communities. This is our objective, the objective of our cultural diversity training. And as far as locally, I can't say or speak for the city of West Hollywood. We continue to be a leader in diversity, equity, and inclusion, and I probably have one of the most diverse operations staffs on the department. My leadership team is about as diverse as it gets. It includes 2 Blacks, 3 Asians, 7 Latinos, and I'd like to also mention the fact that we have a number of people from the LGBTQ community work in the city of West Hollywood. A number of folks who come to West Hollywood because it is a safe place to be. It's a welcoming place, much like the city in and of itself. People drive from many, many miles to come work here in the city of West Hollywood. I often say people pass 3 or 4 stations to work here because of the climate and the environment that we've created here, which is one that's one of acceptance. And I'm very proud of that. Very, very proud of that.
Thank you, Captain. I saw Daniel's hand go up, so I just wanted to make sure
Yeah, sorry, and apologies for being off mute. I'm also running into some technical issues. But Captain Ramirez, I just wanted to note on something that you had said in reference to your Black employees. You referenced to them as Blacks, which is offensive. And I just wanted to note that that the S is offensive at the end of that word.
Okay, no taken. I asked what they'd like to be referenced as, and they told me Black. So
yes, Black, correct. But Blacks with a plural and an S is
I will make it a point to take the S off. Thank you very much. Appreciate it.
Thank you. So just a question on, I think there's different elements of DEI, right? So there's one around recruiting, right? So you talked about recruiting in general, a diverse group, but then, when you did the breakdown, the question is, how do you create more equity among those different groups? Like, for example, if you have 7.5% Black people that are on your force, what are you doing to attract more in terms of marketing and recruiting, specifically for more Black law enforcement? And then the other piece is around retention, right, for DEI. So, when you getting someone to the job is one aspect, but keeping them there is a much bigger deal. And so, what are some things that you're doing to really deal with the retention side of the house, and then also attracting specific groups of people?
Yeah, we have a very, very good group of people who work at our recruitment unit who are doing a ton of community outreach. And the sheriff has stated on numerous occasions is that he wants the sheriff department to look or mirror the communities in which we serve. And, I look at some of these numbers and some of them are low in some of the races that I discussed. That said, there are large recruitment efforts in communities to bring more people of color onto the sheriff's department. If you look at our command staff is more diverse than I've ever seen it in the last probably the 30 years that I've been on. There are more people of color, including women, in command here at the Los Angeles County Sheriff's Department. And then to answer your question in regards to retention, we're not having a big problem losing people on the sheriff department or people of color to other agencies or people who are quitting. I wish I had a better answer for you, but we're currently not seeing that. So it's a difficult problem, difficult question for me to answer. Thanks, Jonathan.
Thank you.
Okay. This next question is for Shay. What are the top 5 strategic initiatives being planned for fiscal year or calendar year 2022? And I guess if you don't have 5, you can name the ones that you do have.
Okay, appreciate that. I think number 1 would be, again, making sure that the education for the public towards our services is there. We've been here in the city and serving the city for quite some time, but I still think there's either some confusion or we just don't know. So I would like to really ramp that up so that everyone knows how to use us and when they should be using us. I think that's important. Also, our possible expansion with returning to WeHo Park, and also possible expansion into some other neighborhoods within the West Hollywood district. Looking to add possible patrol options and change current routes. And also possibly recruiting more ambassadors for neighborhood patrols and higher sense of visibility.
Great.
You said you used the word possibly, I guess.
I know I used it several times. I'm sorry.
So then my follow-up is are these like initiatives that are in stone that you've already identified that you definitely want to do?
So yeah. So I'm sorry to cut you off. So these are definitely ideas that I have. Now, will they go forward? That's yet to be seen. But these are definitely ideas that I have, and I want to push.
What does it take to get a solidified list of initiatives that you want to see funded and achieved? I guess the question. It's great to have ideas.
Right.
It's another way to have your how already identified and your work plan or your detailed approach on how it's going to be executed and what the intended results are.
Some of the things I feel like are already in the process, to be honest. And but some other things as far as like the education of the public and things of that nature, I just need the time to sit down and write these things out. That's all.
Okay.
Thank you. Oh, and also, Jonathan, I do appreciate you bringing up the occurrence with the de-escalation topic. I definitely want to address that with the teams because, again, I was not made aware of anything like that, and I definitely don't want that happening now or in the future.
I also have to tell you, I went back to my sources for my notes, and one of the incidents was like 2017. So I'm assuming that you guys would have rectified by now.
Yeah, I'm sure. And then I wasn't here either. So
right. So I mean, in all fairness, it again, this may or may not be true. It's just good to understand what your de-escalation process is. So thank you.
No worries. Thank you.
Marcus.
Shay, what about, I know you're staffed along Santa Monica Boulevard, which is great, but what about the areas towards the Melrose corridor, where there's been like and maybe this is for the captain too, where there's been a spike in, the follow home robberies and are we seeing is the city of, I know the LA is dealing with most of it, but are we seeing some of that crime spill over into our city, and how are we addressing it?
Well, as far as our guys are concerned, we do have a dedicated Melrose patrol that starts at 1:30 and goes until 10. every day, daily. So it's not a huge team. You may have 4 ambassadors, so that's 2 teams down there patrolling. And it's on the West Hollywood side of things, of course. We haven't necessarily seen or experienced those incidents spilling over while we're there, but we do hear some things, yes. And I think the other question was for Captain, I think.
Yeah, hi Marcus. Yes, we are seeing an increase in that, not to the degree that they're seeing in the city of Los Angeles, but criminals don't look at street signs, so they have ventured over here into the city of West Hollywood. We have sought out the services of one of our detective bureaus to come and assist us with the issue. We do have additional patrols. One of the things I would like to do, and which would really, really help us, is with the behavioral crisis unit and the amount of time my deputies spend dealing with homeless folks that this crisis unit could possibly assist us with. That would just free up my deputies to do more, to travel the north-south streets, to do proactive policing, to look for things that are the ills of West Hollywood right now, the assaults, the mailroom burglaries, the follow home robberies, the street robberies that are currently occurring. I look forward to it, but it would definitely free us up to do more and certainly be able to better protect our community. So I hope that answers your question.
Shay, one more thing. How do residents reach you, reach your department?
Oh, you're on mute.
Sorry about that. We have a dedicated duty line, duty phone number that they can call. The number should be posted on the city's website. It's a 24-hour service, of course. We have a number for both Sunset, because we patrol up there as well, and Santa Monica Boulevard. So the number for Santa Monica Boulevard will activate us on the Melrose side of things, on the mid-city side of things, the west side of things, and of course, the east end, the east side.
Thank you both.
Thank you.
Jorge? Oh, you're on mute.
Okay, just a little advice for the ambassador, because I know they are part of the community already. But for what I see, I live in Santa Monica Boulevard. I always see this group of people on the bike, but they don't interact that much with the community. I think that you guys should stop by for the little business, introduce yourself to, because we have a lot. Santa Monica is mostly small business. So you guys, be more friendly, introduce yourself to this small business, to the community, try to interact more and offer your service. Because like I will say, not many people know what is the number that they can call you, maybe tell you guys to give cards, with the numbers. So you can be more approachable. Yes, just a little, advice, because I noticed that you guys are always out there, but at the same time, you guys are like still, don't be in part, with the community. Don't interact that much. You guys trying to just pass in your bike. And I like the service because I feel more safe. Anytime I see you guys around, I feel safe, because right now Santa Monica is crazy. This city is crazy. It's too many crazy people around. I always see that these people, they just passing by and they pushing doors. I'm like, oh my God, this is getting worse. But when I see you guys on the bike around, I feel more safe. But at the same time, I think you guys should try to improve that, the communication with the community.
Thank you, Jorge. I appreciate that. We do actually proactively go into businesses on Santa Monica Boulevard to check in to see how things are going. We also try to pass out our business card as much as possible, so that people can contact us Over on the east side, not necessarily on the west side just yet, but on the east side, we kind of get off of the bikes and walk. So we do foot patrol so that they can slow down and can get ingrained a little bit more with the community and have contact and answer any questions that people may have. So we're definitely working on that. Perhaps we can do a better job at that, but we will definitely ramp that up. But I do appreciate that.
Thank you, Jorge. Thank you, Shay. Okay, this next question is for Captain Ramirez. What engagement has there been or findings from the LA County Civilian Oversight Commission and this department?
Make sure I'm off mute there. I can say that the staff, city staff, LASD personnel, and the Public Safety Commission regularly attend COC meetings. In addition, in June, the COC and West Hollywood Public Safety Commission hosted a joint community conversation on mental health, homelessness, and law enforcement's response. The collaboration is the first between the COC and the city and encourages strong partnership and future events. On July 12th, 2021, a conversation on equity and public safety featuring Constance Connie Rice was held, and it was actually a really, really great conference, and those of you who watched were able to attend.
Awesome, thank you. So the rest of these questions will actually be for you, Captain Ramirez. So the next one is, what are your thoughts on the advantages and disadvantages of a West Hollywood Police Department?
That is a very, very good question. I've thought about that a lot over the past several years. And you always think about that because there's always talk about a lot of agencies wanting to come over to the sheriff department. Not very many cities wanting to not have the sheriff department as a contract. But that said, I'm hard pressed to come up with any advantages, but there are some definitely some disadvantages. The first one is cost. It is significantly cheaper to contract with the sheriff's department. Some cities pay as much as 3 times the cost as it would to contract with the sheriff department. At first blush, you know, our contracts anywhere between $20 and $22 million. And you look at what other cities are doing that are comparable, you're looking at probably a cost of between $40 and $50 million. And the other thing is the resources. You know, even though many cities have their own police agencies, many cities don't have the money for specialized units such as Aero Bureau, a special weapons and tactics team, a homicide team, special victims teams, and other special investigation unit. With the sheriff's department, this is included in the contract at a fraction of the cost to the city. And then when you think in terms of pre-planned events, many cities must hire a contract with other law enforcement agencies or private security businesses to provide security for planned special events. For example, the West Hollywood Carnival or West Hollywood's Pride event is completely staffed with employees from the Los Angeles County Sheriff's Department. We do not contract out. We have the infrastructure in place to bring in deputies to fulfill that role. And then one of the most important things, as you well remember, with the civil unrest that happened a couple of summers ago, in regards to riots and protests, civil unrest coming on the heels of the violent protests in West Hollywood, we did not receive the damage and vandalism, theft, or violence that was occurring in other surrounding cities. And that was because the West Hollywood Sheriff Station was able to call in resources to secure and protect the city. If it was not a contracted city, these resources would certainly have not been readily available. And for those of you who watch the media or are well aware of what happened in the surrounding cities, Beverly Hills sustained significant damage. Santa Monica sustained significant damage. West LA, Wilshire Division received significant damage, and we can reach out as far as Long Beach. And when you think of who they called to come in and assist them, they are smaller agencies, not in terms of the LAPD. They called us and we happen to be in the vicinity, but the other smaller agencies, they called the Sheriff's Department, and the Sheriff's Department was able to quell a situation with the use of our response teams and our emergency management teams. And that's one of the things that you'll get that you don't necessarily get with a smaller department. Yeah, that's pretty much my answer.
Great, thank you. Next question. How do we interact with or partner with other law enforcement entities throughout LA County?
Okay, I am a member of the West Side Commanders panel here on the west side of Los Angeles. And that consists of captains and police chiefs of the following police departments: Culver City, UCLA, Santa Monica, Beverly Hills, CHP West LA, and LAPD's Wilshire and West LA division. And prior to the pandemic, we got together regularly to discuss crime trends, safety measures, and collaborate on issues pertaining to criminality. We discussed things like, what was going on, what sort of crime trends are you seeing in your city? Are they bleeding over into our city? That information that we share with one another, we're able to take back to our respective agencies and find out if there's patterns or trends that are affecting us here on the West Side. And currently the one we're working on collectively and collaboratively is the stealing of the robberies of high-end watches and high-end jewelry in these follow home robberies. We have, not at liberty to discuss a whole lot, but we have developed some intelligence, and it's because of us working together and sharing that information. And we are also sharing resources.
Great. Just a few more questions, so appreciate you taking the time to do this. You as well, Shay. What are a few things that keep you up at night? I hope that list is not long.
No, it's actually very short. Quite frankly, those of you who are parents or have family can absolutely relate to this. It's really the first one on my list is the welfare and safety of my children. I would say second is the welfare and safety of my station personnel. And probably this is the most recent one, and it actually has kept me up at night. With a talk of conceivably cutting the West Hollywood station law enforcement budget, I was on a conference call with some folks from the Sunset Business District just prior to the civil unrest. And one person was on the line and she said her biggest fear is watching the iconic Sunset Strip go up in flames. And the thought of that really affected me, which made us come up with a game plan to deal with traffic, a game plan to deal with looters, and we were very, very effective. So I think the thought and image of our city being burned, looted, and vandalizing during civil unrest weighs really, really heavily on me. Because I have built great friendships here in the city of West Hollywood with the city, with administrators, with business owners, with hotel, with restaurants. And it becomes very personal. It's very, very personal. And I take it very personally.
Appreciate that. Let's see. Okay, I think we just have two more. And I think, again, you already touched on this. What measures are being taken to address the increase in crime over the past few years in the city? You kind of touched on this with the follow home robberies, but.
Yeah, I think I touched on most of that. Hang on one second here. Let me refer to my notes here. I wrote it down. Can you repeat the question again?
Sure. It's just speaking to the measures that are being taken to address the increase in crime over the past few years. I know that you, in a previous question that touched on our collaboration with other law enforcement entities, such as the City of LA, when it comes to the follow home robberies, you kind of touched on it a bit, but if there's anything else you wanted to add.
Yeah, one of the things I'd like to add is, recently we just gave a report to the City Council in regards to our 6-month report. And, our part 1 crimes, which are the serious crimes like homicide, robbery, burglary, rape, grand theft, arson, and assault, they actually decreased for the first part of the year. And there were 678 total part 1 crimes, which is the lowest January through June total in the city history. The previous low was 719 total part 1 crimes, which was set in 2020. However, both years were heavily impacted by the COVID-19 pandemic related closures to clubs and businesses. And I guess for reference purposes, in a typical year, the January through June part 1 crime numbers for all 3 years prior to the pandemic averaged about 1,070 incidents. As mentioned, the pandemic played a large role in the reduction of part 1 crimes. March and April of 2020 were the lowest part 1 crimes in the history of the city using this same crime reporting method. March 2020 had 92 part 1 crime incidents, and April 2020 had 82. And the average part 1 crimes per month prior to the pandemic were 180 to 220 part 1 crimes per month, and that is slowly moving back up. We are approaching those numbers again with the reopening of the city. And I'd like to add that prior to the pandemic, at the beginning of 2020, we were almost 30% lower for part 1 crimes than that same time the year before in 2019. So in as much as I'll give the pandemic the numbers, we were of 40% reduction in crime, we were approaching 30% prior to the pandemic. And that was due to the hard work of my deputy sheriffs, my detectives, my MET team, my cops teams, my patrol deputies, and my community policing teams. The cops team works during the day to deal with our unhoused community, develop relationships with our residents and businesses. Our entertainment policing teams work the evenings to ensure nightlight safety. We were the first city to contract for a MET team, and our MET team does an incredible job of working with people in community with mental health issues. And quite frankly, their work has reduced the incidence of force, created peaceful outcomes to high-risk situations, and prevented injury to the patient, responding deputies, and the public. And more importantly, they freed up very, very valuable resources. Like I mentioned, we continue to work with our partners from LAPD and Beverly Hills on the robberies that have occurred over the last several months. Our cops and EPT teams have conducted special operations to address a large pickpocketing issue that has gone on at our restaurants, at our nightclubs and bars. And we continue to work closely with security and management at our nightlife venues to mitigate these issues. Let me see, the city has provided resources to have foot beats on the east and west side of town several days per week. And we have also expanded our park patrols. So we have deputies walking the parks to ensure the safety of our folks who are using them. I discussed the reimagining our community in regards to block by block, MET, cops, entertainment policing teams. But on that end, I really want to thank our Director of Public Safety, Kristen Cook. She's been actually a godsend for me, for Lieutenant Mulder. And the wonderful partnership we've created is it's just been phenomenal, and it's worked very well. And we always appreciate her support and flexibility. And her leadership has allowed us to better serve and protect the city that we've come to know and love.
Thank you, Captain, and thank you, Kristen. So this last question, in your opinion, what is working or not working as it relates to law enforcement for the city of West Hollywood?
As I mentioned in my comments about crime in West Hollywood, our cops and entertainment policing teams, they're critical parts of our community safety program. They conduct outreach to everyone in our community. They can also focus on issues that we are having, such as proactive patrols, plainclothes operations, foot beats, or bike patrols. We utilize them for a lot of different things. And what they do is they take care of the quality of life issues so that our patrol officers can answer the more serious calls, like folks in distress, babies choking, folks having a emergency episode, burglaries, robberies, things of that nature. And as I previously mentioned, West Hollywood has already led the way by employing code compliance block by block, our MET team. And some of you may know these, we work with the Center for Policing Equity on doing a study just to see how well or how not well we're doing here in the city of West Hollywood. We've given them a variety of different numbers, our statistics, to see if there's any way we can improve on the services that we're currently providing. We provided them a number of documents. They're currently working through them. We're excited to hear their feedback. But what I can add is that they were very impressed with the public safety model that was created by the city of West Hollywood. And I guess in closing, I'd like to add that, West Hollywood is a world-class city. The city continues to grow, it continues to expand. And you see that on a daily basis with the numerous construction projects around the city. And as a law enforcement agency and as a city administrator, we need to look ahead to meet the community safety needs now and in our very near future. And from a law enforcement perspective, I want to expand our cops and entertainment policing teams. Last year, due to COVID-19 pandemic related budget issues, we cut a deputy and a sergeant that were cut last year. I recently asked the city to refund them as crime is on the rise. We can certainly use them. And again, like I said earlier, I would also like a dedicated foot beat and bike teams for the entire city. And I strongly feel that with these additional programs, we can do more to advance community safety.
Thank you, Captain Ramirez. With that, I tried to do my best. This is for the task force members to kind of combine some of the questions. But if there was something that you feel like I didn't bring up or address, feel free to unmute yourself and ask Captain Ramirez or Shay while they're here. If not, and if we covered everything, thank you so much to Captain Ramirez. Thank you, Shay. Thank you, Kristen. We really appreciate you taking the time.
No problem. Thank you for the invitation, and it's great to see all of you.
Thank you. Thank you for everything. Okay, moving on to our next agenda item, which is around the subcommittee items. We want to do subcommittee report outs, and just so you know, the economic community development and city contracting / RFP process that has been on hold only because we had a member resign from the task force, and so there is going to be a replacement, and so at that point we will reconvene that subcommittee. In the meantime, would like to know if there's a report from the Housing and Homelessness and Social Services Task Force.
So I can probably kind of speak
Yeah.
to that one maybe for Shannon and Jorge and Giselle. We were originally going to schedule something and invite David Juni, the social services manager, but we knew that he was coming this evening. So we kind of just decided to tack on the questions that we would have addressed in the subcommittee meeting at the meeting here tonight. So there probably isn't much of an update, but Shannon or Jorge or Giselle, feel free to interject if.
Yeah, we didn't have a meeting last week. It was tonight, so we have nothing to report back.
And that's okay. All right, so what about public safety?
Okay. We did meet a couple weeks ago. We reviewed the city council meeting that had previously happened the week before. A lot of it was in discussion regarding a survey that had been done. So it was really informative to review that. But a lot of it, we were also waiting for this meeting as we were anticipating hearing from the Sheriff's Department. So I think coming out of today's meeting, Krupa, Marcus, Jasmine, and myself will have a lot to talk about.
Yeah. Can I be a fly on that wall for that conversation? Just kidding. I think that's probably a good summary for all of our subcommittee report outs. I'm assuming that we'll probably have more for December, or more elements and more things to report on in December, and then hopefully maybe that can be the first month where we actually use our new packet, our report. So moving on to item number 9 for the discussion about community partners, business owners, community activists, service providers, and stakeholders of interest to the task force. Is there anything that the city staff wanted to talk about or ask or?
So we all just decided, myself, John, and Andy, to just keep this as a standing item, just in case there were new organizations or divisions or departments that you all wanted to hear from. So if it's okay if there are not any here tonight, but moving forward, we like to include it as a standing item just in case there are updates.
So are there any new items? I think, given that we're probably all meeting on our subcommittees in the next few weeks, probably doesn't, I'm assuming that we probably have more to contribute probably next meeting. So, but I will hold my breath for any comments. Okay, moving on to item number 10. So task force liaison recommendations. Jasmine, do you want to touch on that?
Sure, yes. So at the last meeting, I believe it was our October meeting, we kind of touched on possible boards and commissions that you all may or may not be interested in being a part of. So what we did as staff, I will share my screen, is kind of just assign people based on the conversations that we've had. And so we wanted to go over that. We created kind of like an Excel sheet, which shows the meeting times. So that way it would be a lot easier for folks to determine whether or not they can kind of fit that in their schedules. Let me share my screen. Okay, can everyone see my screen? Okay. So everyone is assigned to one advisory board and one commission. take a look at the advisory board or commission that you're assigned to. If it's not a body that you necessarily want to be responsible for, we can have that conversation now. Again, we just tried to do our best to go off of the conversations that we've had at previous meetings and interests that some of you have expressed in particular subject matter.
This is good for me on my end.
Okay, thank you, Daniel. Just really quickly, so as you see here for the Human Services Commission, Planning Commission, Public Safety, and Rent Stabilization, those are the only commissions that stream their meetings every month. So for the folks that are assigned to them, it's a little bit easier because you can kind of just tune in online. But for the others, they aren't streamed.
Can you say that one more time? Which ones are?
So yeah, so for the Human Services Commission, Planning Commission, Rent Stabilization, and then Public Safety, those are all streamed online every month. Some of the other ones may, depending on a special meeting or depending on what the agenda is, but the ones that we know for sure are streamed every month are those four. So open to if everyone is okay with their assignment, if there are any scheduling conflicts. Again, I know at the last meeting we discussed too, obviously if something does come up that happens, and that's fine, but if we're able to kind of incorporate this into our work as social justice task force members, even if that means that you're checking the agenda and the minutes, if you're not necessarily able to make the meeting or tune in to the meeting, that's sufficient as well.
Should we add a standing topic, Jasmine, around kind of report outs? Like it can be verbal, nothing formal, but just here's what I heard.
For the task force liaisons?
Maybe it's a what we're hearing. Yeah.
Yeah.
The agenda.
Absolutely.
And that might help us talk about the intersection between each of these and our social justice task force.
Absolutely. Okay, so if there not any questions, I'll turn it back over to Jonathan so someone can make a motion to approve the recommendations, and then we can do a roll call.
All right, motion to approve the recommendations.
Second, Zamilpa.
I was just asking if there is a motion to approve the recommendation. So
I'll make a motion to approve the recommendation.
Do I get a second?
I'll second.
I love it. Shannon and Giselle. All right. So with that said, Jasmine, do you want to go ahead and take a roll call for the vote?
Sure. Jonathan Wilson.
Aye.
Jorge Separac.
Aye.
There you go.
Shannon Morton.
Aye.
Marcus Smith.
Aye.
Krupa Desai.
Aye.
Giselle Washington.
Aye.
Daniel Zamilpa.
Aye.
Motion passes.
Excellent. Go team. The next item, for some reason, my screen changed a little bit. Sorry. Are there any items from staff? And I guess that's the question for you at this time, Jasmine, and maybe John.
Yes. So I don't think I have anything on my end. Just a reminder, as Jonathan mentioned, we did have a resignation, but we also have an appointment coming up. And I believe that will be heard and hopefully approved by council at the December 6th meeting. So John, correct me if I'm wrong, but I think the new social justice task force member may be sworn in by our December 21st meeting.
Yes, so they would be appointed at the December 6th meeting, and then we would swear them in at the next social justice task force meeting.
Okay.
Great. How exciting. All right, so moving on to number 12, with sadness, I'd like to adjourn this meeting. Just so you guys know, the next meeting is going to be on Tuesday, December 21st at 6 p.m. And that'll be also teleconference. And with the new variant coming out, not sure when things will not be in teleconference. So anyways, hang in there, be safe, get your booster shots, and thank you. This meeting's adjourned.
Thank you, everyone.
Thanks, everyone.
Thank you. Thanks,
Bye.
Jonathan.
You.